Dear students, Assalamu alaikum. Today I am going to deliver a lecture for class 12th, subject zoology. My today's topic is related to the reproductive health, and the topic is sexually transmitted diseases, abbreviated as STDs. These diseases are also called sexually transmitted infections or venereal diseases, abbreviated as STI or VD. These are the diseases actually which spread through unprotected sexual intercourse or genital contacts. Depending upon the causative agents, these diseases are classified into three categories. Number one, sexually transmitted disease caused by bacteria. These include chlamydiasis, gonorrhea, and syphilis. The causative organism of the chlamydiasis is the bacteria Chlamydia or trichomatis. Now, symptoms in males. In males, it causes urethritis, and the symptoms of urethritis include a thick discharge, burning sensation on urination, and frequent and painful urination. So, for the symptoms of in females are concerned, in females, the most common site of infection of this pathogen is cervix, that causes cervicitis. This cervicitis can cause production of thick mucus and discharge of pus. The infected females also experience low back pain, abdominal pain. This chlamydia infection may sometimes be transmitted from mother to the infant during childbirth and infect the eyes of the newborn. So for the treatment of this disease is concerned, once diagnosed, it is treated by proper doses of tetracycline and doxycycline, recommended by an expert physician. Now, second important bacterial disease is gonorrhea, which is caused by the bacteria Neisseria gonorrhoeae. Symptoms in males include urethritis, that causes the discharge of pus and painful urination. In males, it may also cause the inflammation of the prostate, called as prostatitis. Symptoms in females include inflammation of vagina, which may separate into the uterus, uterine tubes, and pelvic cavity. Sometimes in females, it causes inflammation of the peritoneum, known as peritonitis, which is a life-threatening condition. Now, the third important disease, bacterial disease, is syphilis. So for this, syphilis is concerned, as I already told you, that it is caused by the bacteria Treponema pallidum. It is transmitted through sexual contacts. It is also transmitted to the fetus through placenta. The disease passes through several stages, such as primary stage, secondary stage, and then the tertiary stage. In tertiary stage, this infection damages the organs, and when the signs and symptoms of organ degeneration appear, the disease is said to be in tertiary stage. Now, the sexually transmitted diseases caused by virus include, the most important is genital herpes caused by HSV2 or type 2 herpes simplex virus. This STD is caused by the HSV2 virus. The symptoms of this genital disease include painful genital blisters on prepuce or glans pens and penile shaft in males, and on the vulva or vagina in females. Second important viral STD is genital warts. Now, sexual transmission of genital warts is common and caused by human papillomavirus or HPV. Patients with history of genital warts may be at an increased risk of cervix, vaginal, anal, vulval, and penile cancers. The treatment of this disease consists of cryotherapy with liquid nitrogen. It may also include laser surgery or topical application of podophyllum in tincture benzoin. Now, lastly, the last viral disease, and the most important viral disease, is AIDS, which is caused by the human immunodeficiency virus, And everybody knows now that this disease is very dreadful disease because it damages the immune system of the person. It is the most, therefore, it is the most dreadful viral infection caused by HIV virus. It is transmitted through blood and also by sexual contacts between male and female through vagina, oral, or anal intercourse. Male homosexuals transmit HIV to their partner by anal or oral sex. Due to this infection, the HIV virus destroys the immune cells, especially the T helper cells, whose number decline due to the death of infected cells. This results in the progressive collapse of immune system and the person becomes susceptible to opportunistic infection. Now the last infection, which is the last STD, sexually transmitted disease, which is caused by protozoa, is trichomoniasis. It is caused by a protozoa known as Trichomonas vaginals. The symptoms of this disease include yellow vaginal discharge with a very offensive odor, and very severe vaginal itch. Though all persons are vulnerable to these infections, their incidence are reported to be very high among persons in the age group of 15 to 24 years. These infections can be prevented easily by following the simple principles such as be loyal to your spouse and avoid sex with unknown partners or multiple partners. Secondly, use of condoms during intercourse, and then seek medical advice from a qualified doctor for early detection and the treatment. These STDs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Thank you. Thank you very much.